Hi everyone, my name is Armila Kajani. I am the clinical nurse specialist here at Dr. Kemp's house in Hamilton. Today, I'm excited to share more about the work I do here. But first, I want to emphasize the significance of tomorrow. Tomorrow is Tuesday, April 16th, and it is Advanced Care Planning Day. So this day holds, of course, particular importance for my role and for hospices in general. I'm eager to shed light on its importance to you and to get the care you want from healthcare professionals when the unexpected or expected happens in your life. So, in my role, I come across a lot of patients with a life limiting illness, and when they have not made their advanced care planning decisions, I see that this often becomes even more of a stressful situation for their loved ones. Patients and loved ones go through tough times during their journey, and when advanced care planning decisions have already been made, it makes it much easier for the person they've allocated to honor and follow their wishes. And of course, this all comes into play if the patient is no longer able to speak for themselves, then healthcare professionals would turn to the person that you've allocated to speak for you. So when your wishes are known and carried out, we know that it was what you wanted, it was what you had wished for. Some of the patients I come across have been diagnosed very recently with a terminal illness and with a very short prognosis given to them. And so, up until perhaps about a month ago, they may have been driving, they may have been feeling well and feeling healthy overall. So, advanced care planning is really not just for patients who have been diagnosed with a terminal illness, it is really for everyone to plan for. So, some of the things we're going to review the 5 steps to creating an advanced care plan. The first one is to think. Think about what matters to you, your values, your wishes, and how they may influence your healthcare preferences. You may also want to think about specific rituals around your end of life care plans. You may want to learn about specific medical treatments, what options of care are available, and perhaps even future housing options that may fit into your lifestyle in later years. You may want to decide on who will speak for you if you cannot speak for yourself. You may want to talk with others about your future, your health priorities, and your personal care. And then lastly, we're going to talk about recording and sharing your wishes. So others are confident that they have carried out those decisions for you as you had expressed. So for the next 5 days, I'm going to be talking about each one of these steps right here on social media. You can also go to our website, kempcarenetwork.org, and explore how we can help. You can click on planning for a step-by-step guide. The first step, as we talked about, touched on briefly, is to think. Think about what matters most to you. You may want to get a paper and pen out because here is your homework. So advanced care planning involves describing your end-of-life wishes, including values, goals, and preferences for medical procedures. If you have a health condition, you may have already discussed this with your healthcare team, but it is important to think about this even if you don't have a life-limiting illness. It's crucial to name one or more substitute decision makers to speak on your behalf when you cannot speak for yourself. So most often, patients choose a trusted family member, and that is okay. But you must want to think about, how that person will carry out your wishes, will making sure that they're not biased and they're really honoring what you want, as you've expressed. So remember, your plan can be changed at any time and will only be used if you cannot speak for yourself. So if you are able to speak for yourself, you're of sound mind, healthcare workers will only turn to your family when you are no longer able to speak for yourself. So some of these important questions that you want to consider are: who do you trust to make your healthcare decisions for you? What matters most to you in life? And these are very tough decisions. None of this is easy. We're hoping that you're going to start thinking about all of this. Um, this year's advanced care planning theme is "If not you, then who?" And this is what we want you to start thinking about. The best time to think about this is now, when you are of sound mind, hopefully healthy, and can make these tough decisions for yourself. So this may seem like a lot and can really be a heavy and difficult topic, but it is a really important one, an important conversation to have with yourself, your loved ones. And tomorrow, same time, same place, we will talk about step 2, which is to start learning about medical procedures, some of the medical terms. And we look forward to having you here with us. Thank you so much.